understanding and how to effectively treat and alleviate pregnancy-related low back pain coming up. One of the most common complaints in pregnancy that I hear from my pregnant clients and students is low back pain. My back hurts, my back aches. And so I have created this series of 4 simple practices that you can do, that each one is short and they can be done singularly. You could just do one here and there throughout your day, or you can put them all together for a longer, more complete practice. And each one is designed to effectively soften the excess curve in the lumbar spine. So let's talk about that. Our low back, our lumbar spine naturally has a little bit of a curve forward, going forward in our bodies, just in general. And then pregnancy, the weight of the growing baby, and we'll talk about that with my assistant Morgan as she is going through the practice, you'll see like how the weight of the baby really exaggerates that lumbar curve. And what that does is it kind of squashes this low back muscle called quadratus lumborum, just kind of squashes it up. And then the erector spinae muscles are muscles that run along the spine and out along the ribs on both sides. They go from the pelvis all the way up to your skull. And those erector spinae muscles are what keep you upright. And then when you get exaggerated in that lumbar curve, or otherwise known as the lordosis of the low back, when that gets exaggerated, those muscles are kind of working extra hard. They get activated in tension. And those muscles can refer pain all up and down the back, focusing mostly in the low back, even down into the glutes and the top of the pelvis. So doing these practices to kind of correct and soften that hyperlordosis that shows up a lot in pregnancy is going to significantly reduce your low back discomfort, and even will take care of some other discomforts that you might be experiencing, especially later on in your pregnancy. So let's get started. We're going to go through those 4 simple things that you can do so that you can alleviate this pain and really get back to enjoying your pregnancy. So throughout pregnancy, as a woman's belly gets bigger and baby grows inside, the pull increases on the low back, which can start to cause some strain in the low back muscles. And you can see here, and Morgan, I'm going to ask you to just reach your arms forward a little bit so that we can see your back curve really well. You can see that that back curves significantly, and that's called a lordosis in the low back. We're designed to have a little bit of a curve like that, but not quite as much as we see late stage pregnancy. So this creates strain in all these low back muscles, pulls on the hips of the pelvis, and can just create a lot of pain and discomfort for our pregnant mama. So you can lower your hands, Morgan. So we're going to do practices to help alleviate the low back pain relative to this increase in lordosis in your body. And stepping to the wall, placing your back against the wall, lowering down by bending your knees a little bit, and then tuck that pelvis under and press the low back toward the wall. And then continue breathing. Press your feet into the floor a little bit to rise up just like a ½ an inch, and that's going to engage the quads, stabilize the knees, and at the same time you're creating some length in that low back to stretch those low back muscles and ease some of the tension and the pull in the low back. Taking several breaths here, maybe up to 30 seconds or even a minute, is a really great break to take throughout your day, especially later in pregnancy when that baby is drawing your back into an exaggerated lumbar curve and straining those low back muscles. So we'll just take another breath or 2 here, Morgan. Good. One more breath. Keeping that pelvis tucked under, pressing low back toward the wall. And then you can just slide yourself up and come out. So now we're going to move through a little strengthening and releasing practice for the hamstrings. and strengthening of the quads. So Morgan, I'm going to ask you to bend your knees, reach your arms back. This is a swimmer chair pose or Utkatasana. Notice her arms are open and turned open like that. Squeeze your shoulder blades towards each other. And then now you're going to bring your hands to the chair and come into like a modified Uttanasana, standing forward fold. Little bend in the knees. So as belly gets bigger, it blocks your ability to bow forward. So bending in the knees and then tilting the pelvis and reaching the buttocks up and back gives that nice pull on the hamstrings. And then we're going to go just back and forth between these two poses. So coming up, bend the knees, rotate the arms open, squeeze the shoulder blades towards each other, and then bring the hands back to the chair. Keep a little bend in the knees, tilt the pelvis, reach up and back. We're going to do that 3 more times. Bend the knees, squeeze the shoulder blades towards each other, arms are rotated open, and then hands back to the chair, lifting the pelvis up, tilting and reaching the buttocks up and back, stretching those hamstrings. 2 more times. Bend, squeeze shoulder blades, open chest, and then hands to the chair. Keep a little bend, tilting the pelvis up and back. Last one, bend the knees. Nice long spine, squeezing those shoulder blades towards each other. And then hands come back to the chair seat, keeping that bend in the knees, tilting the pelvis up and back. And then now we're going to keep the hands on the chair and just wag your tail a little bit side to side. Just kind of stretching through that low back. And now I'm going to have you do a little extra tuck in the pelvis. Draw that baby up into your belly a little bit more. Keep the knees bent and keep that tuck while you wag your tail side to side. And you can feel a little bit of that difference. It's going to help stretch those low back muscles. Yeah, great. Stretching through the sides, stretching those low back muscles, and then coming back to center. And then to come out of this pose, you can bend your knees a little bit more, bring the hands back to the thighs, and walk yourself up to stand. So continuing our journey with alleviating low back pain in pregnancy, you're going to come to the floor and come to all fours. And now Morgan has told me that, just come into regular, Morgan has told me that she is having some carpal tunnel symptoms, and that's putting a lot of pressure on her wrists. So there are a couple steps that you can do. One is widen your hands so that they're mat distance apart. And so that's going to take a little pressure out. And then you can also walk the hands a couple of inches forward, and then it's going to soften that angle at the wrist and make it a lot less pressure. Now, another thing that you could do is take a folded blanket or a towel and slide it under the heels of the hands. And so that just the finger pads and the fingertips are off and the heels of the hands are supported. And so again, effectively softening that angle at the wrist. Either of those things is going to alleviate some of those symptoms of carpal tunnel. So now we're going to move into a little bit of cat cow. And we've talked about that this back pain is relative to a little too much tilt in the pelvis. So when we do prenatal cat cow, you want to accentuate the tuck a whole lot. So Morgan's going to start by tucking her pelvis under, rounding and looking in toward her baby. Hi, baby. And then you're going to open up, tilt back a little bit, and really focus more at extending the lumbar spine, reaching the buttocks back in space, as opposed to up toward the sky. And then just keep moving just like that. Tuck, accentuate, look in. Hi, baby. If you could see past your big boobs right now, right? Then you could see the baby. And then tilting up and back. And we're going to do that 3 more times. Tuck, focusing on the tuck, lengthening that low back. Little bit of a tilt. And the thing about pregnancy too, when you're moving through yoga, just keep going as is comfortable, Morgan. In a lot of yoga practice, you synchronize your breath with movement. And in pregnancy, you don't have to do that, because as you've probably experienced, it's very different from day to day, how deeply you can breathe, how fast your breath is, and you don't want to hold your breath ever when you're pregnant. So don't hold the breath, just keep breathing and moving your body as feels good. So one more tuck we're going to do here. And I want you to stay here. Keep breathing. Really tuck the pelvis in as much as is possible. Yeah, beautiful. And then you're going to just return to a neutral spine. And then if you need to take a break with the hands, Morgan, I'm going to invite you to move that blanket out of the way and come down to your elbows for a little while. Yeah, there you go. So this is another way that you can take some pressure out of the wrists. And then Morgan's going to do a little bit of a leg lift up and back. So Morgan, you're going to stretch that right leg up and back and lift it up, and then accentuating that tuck a little bit. Notice the foot comes a little closer to the floor. That's okay. And she's going to tilt and tuck, or point and flex her foot as it's in the air. Now this does two great things for the low back. Strengthens the glutes and the hamstrings, which helps the tuck of the pelvis and creates that length. And then you can lower that right leg down to the floor. And then you can choose, Morgan, do you want to come up to your hands or stay down on the elbows? And then your left leg is going to lift up and back. And then really focusing on that tuck. See, she's doing a beautiful job tucking that pelvis under, lengthening the lumbar spine, and then pointing and flexing. Do some ankle circles. Take the Rice Krispies, snap, crackle, pop out of the ankles. There it is. It's just got a little crack. And then lowering the left leg down. Wag your tail a little bit side to side. That always helps to open and free the sides of the low back. And then we're going to do that one more time on each side. So coming back to center, reaching the right leg up and back behind you. And then maybe doing some pointing and flexing, making sure the pelvis is tucked under, making sure the low back is lengthening. And then right leg comes down, left leg comes up and back. Keeping the tuck in the pelvis, and then circling, pointing, and flexing the left ankle, keeping a little hydration going in those joints. And then lowering that left knee to the floor. Great. And then from here, we're going to come up to find a comfortable seat and do a very gentle twist to finish our helping with low back pain in pregnancy. Great. So you're going to find a comfortable seat, and we're going to just do some gentle twists to round out our practice and bring a little rotation, hydration to the lumbar discs. So sitting comfortably, you can have the soles of the feet together, and you want to obviously sit high enough up so that baby has space. You want to keep some space for baby to kind of be nestled right there. And you're going to sit up really nice and tall. And then you're going to just turn to the right, bring the right hand toward behind you. We're using that yoga bolster, so Morgan's going to place her right hand on the bolster, and the left hand can stay just relaxed on the inside of the leg. And not a big push into the twist. Really, you want to think about lengthening the spine. You want to think about maybe a tiny tuck, and you even add a little bit of a tuck here while you're twisting. And then we'll twist to the other side. We're going to rotate the body to the left. Left hand comes behind you, and right hand just resting on that right inner thigh. Lengthening the spine, using the belly muscles to come into a slightly deeper twist, not pushing real hard with the hands. And we'll go back one more time to each side, lengthening through the spine. Right hand comes back, left hand to that inner thigh. And just a nice gentle twist, and then switching to the other side again. And this could be done several times as like a flow, continuing for another minute. So let's just keep going. Morgan, I'm going to have you just go into that kind of moving in and out of the twists at whatever pace feels comfortable for you. So not real fast, just moving. Again, no need to sync the movement with the breath so that you're holding your breath. Please don't hold your breath in your pregnancy. And just moving side to side. Beautiful. And one more time to the left. And then coming back to center, staying nice and tall through back of the crown of the head, rises up to the sky. And that's our practice, prenatal yoga, for helping with low back pain.